When doing movement pattern tests, it's not so much the strength of the movement, but the sequence and activation of the synergists involved in the movement pattern. Furthermore, muscle patterns that we see can help us with our diagnosis of possible muscle imbalances and how the motor control of those muscles work together. The first movement pattern test is the hip extension. So what you're going to do is you're going to have one hand touching the hamstring and the glute max, and the other hand touching both sides of the erector spinae. And what you should see is the glute max firing first, working with the contralateral erector spinae, and then the hamstring should be going. Overactivation of the hamstrings and erector spinae and delayed or absent contraction of the glute maximus is also a faulty movement. And the porous pattern occurs when the thoracolumbar extensors or even the shoulder muscles initiate the movement, delayed or absent the glute maximus contribution. You can also see from this hip extension is if they have an anterior tilt. An inability to make knee extension during the test should be also noted, as observations may suggest hamstring dominance over the glute maximus. The next test is hip abduction. So what you're going to do is have your client lay on his side, make sure his hips are stacked and his body is in a neutral position. What you're going to have him do is abduct his hip, and what should fire first is the glute medius, glute minimus, and TFL. So you'll have one hand on his glute, on the side of his glute, his medius, and one on his TFL, and the other one on the top of his hip bone and the bottom of his ribs. So what should actually happen is the contraction of the glute medius and minimus, and then the TFL, and then only after 20 degrees should the quadratus lumborum take over. The porous movement pattern is observed when the hip abduction is initiated by the contraction of the quadratus lumborum before 20 degrees of hip abduction, resulting in lateral pelvic tilt or a hip hike. So this is the trunk curl up activation. So what you're going to do is have your client lying supine with knees at 90 degrees. And you're going to place your hands underneath their heels. So if you feel heavy pressure against your hand, that indicates that there is a hip flexor dominance over the abdominal muscles.